Good morning, everybody. My name is Bianca Kurtzen with Constellation Consulting, and we are pleased to present Day 2 of the New Mexico 2022 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Nicotine Use Prevention and Control Program. For more information about the summit, please visit our website at nmhealthequity.com or .org, excuse me. Due to COVID-19, this year's Summit on Health Equity remains online. We appreciate those who've helped participate and support with the planning process. I also encourage you all to utilize this year's Summit on Health Equity event app. The Whova app provides all of you with opportunities to network online, which I know a lot of you have already started, create discussion groups, visit our exhibitor pages, download files provided by some of our presenters, and more. It's a great tool for you to use not only during the live sessions, but also after the event. Plus, when you use the app, you will earn points, which will mean prizes. Please check out the leaderboard in Whova for more information. For our sessions today, we are asking that attendees remain on mute. If you have a question for today's presenter, please use the Q&A function within Whova, and we will address the questions after the presentation as time allows. If you need assistance during this session, please utilize the Q&A feature as well, as organizers will be in there to assist you if needed. You could also email us at info@constellationnm.com. Following today's session, we appreciate if you would take a few moments to complete the session feedback survey. If you'd like to request community health worker or social worker CEUs, please include your name and email on the evaluation. The CEU certificates will be emailed to you within 60 days. If you need assistance with CEUs or have questions, please email us at info@constellationnm.com. Finally, before we begin today, Constellation acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black and Asian Pacific Islander communities with whom we stand in solidarity. We are New Mexico, and we are built strong by the diverse people in our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here and encourage each of you to seek, learn more, become involved, and support organizations who are building a better New Mexico for us all. So today we're excited to host Diane Yentel. Ms. Yentel is the president and CEO of the National Low Income Housing Coalition, a membership organization dedicated solely to achieving socially just public policy that ensures people with the lowest incomes in the United States have affordable and decent homes. Diane is a veteran affordable housing policy expert and advocate for over nearly 2 decades on work on affordable housing and community development issues. You could read her complete bio in our event app in Whova, as well as our website. Please help me welcome Diane Yentel.
Hi, thanks for the introduction, and thanks for the welcome and for the opportunity to be here today to talk about the affordable housing crisis, its impacts on public health, and its solutions. We certainly have our work cut out for us. These last 2 years during the pandemic have really been a watershed moment for our country. They showed us in profound and unforgettable ways who we are as a country, and we can't go back. These years have laid bare the deep structural racism on which our country and so many of its systems was built, and how that structural racism harms and kills Black, Indigenous, and other people of color. And it made clear our collective responsibility to repair this deep injustice, to work towards racial and housing justice. The years revealed the collective harm that comes from allowing homelessness and housing poverty to persist, and to make clear that housing is healthcare. It always has been, and that stable, affordable, accessible homes are a prerequisite to personal and public health. The years revealed the pervasive housing crisis for the lowest income people who struggled so mightily to pay the rent before the pandemic and during the pandemic, and who will continue to struggle after the pandemic, unless and until the federal government invests in solutions to make homes affordable to the lowest income people. The years showed us just how quickly and effectively the country can implement emergency protections and provide emergency resources to keep renters and people experiencing homelessness safe, healthy, and housed. And the years showed us, as housing advocates, organizers, providers, tenant leaders, impacted people, just how deep and broad is our movement for housing justice, and how powerful and effective we can be when we work together. Because as difficult as the years have been, we rose to the challenge and we achieved unprecedented resources and protections for renters and unhoused people. These days, I'm sometimes asked, what happened to the eviction tsunami that some people that I predicted at the height of the pandemic? And I'm asked, if the eviction tsunami never happened, does that mean that our predictions that it could were wrong? And honestly, I am equal parts amused and frustrated when I get asked this question, because to me, the answer is so obvious. An eviction tsunami didn't happen during the pandemic, not because we wrongfully warned of one, but because advocacy works, because our collective advocacy worked. In August of 2020, the best available data made clear that up to 12 million households were at risk of losing their homes if the government didn't act. These were many of the same households, the same families who had struggled to pay the rent before the pandemic, but now had lost jobs, lost hours at work, lost wages, and had increased healthcare, childcare, internet, and other costs. By August of 2020, the small patchwork of pandemic protections and resources had expired, and renters stood at the edge of a cliff. So advocates sounded the alarm, and federal, state, and local governments took heed, providing historic resources and protections to keep tenants housed. Together, we fought for and kept in place a national moratorium on evictions for non-payment of rent. This was historic, unprecedented. In the history of our country, there has been nothing like such a broad protection to keep renters housed. The eviction moratorium was a public health measure. It reduced evictions, which had been proven to be associated with increased cases of and deaths from COVID-19. So against all odds, and despite some very powerful and very well-funded opponents, we kept that moratorium in place for almost a year. And the moratorium was flawed, it was incomplete. But the moratorium we fought for together kept millions of people stably housed during the pandemic. We also achieved $46.5 billion in emergency rental assistance, an unprecedented level of support for low-income renters. For perspective, that's more than 46 times what the federal government allocated to help renters during the Great Recession. It's the largest single allocation of resources exclusively for renters in history. And once we achieved those historic resources, we worked together with the White House, with the Department of Treasury, with state and local partners, program administrators, impacted people, to build out a new national infrastructure to get these vital resources to the tenants most in need, to keep them stably housed. And emergency rental assistance programs got off to a painfully slow start. It was caught between two administrations, and it's slow work to build, staff, and administer major new programs during a global pandemic. It takes time to design effective programs that center and prioritize the lowest income and the most marginalized people. So at the National Income Housing Coalition, we worked hard to ensure that those resources reached the tenants most in need. We tracked and analyzed over 500 emergency rental assistance programs throughout the country. We researched ERA implementation. We tracked and measured and amplified best practices. We worked closely with the White House to inform and improve guidance and oversight. Now, as of the end of March, over 5 million emergency rental assistance payments have been made, and ERA has reached over 10 million people in over 3.5 million households. And the data, the good news gets even better because the data makes clear that our collective efforts to ensure that these funds reached the lowest income, the most marginalized people, is working. The households, the vast majority of the households that have so far received assistance are predominantly very low and extremely low income, and they are disproportionately people of color, the very people who are at greatest risk of eviction during the pandemic. And this successful alignment of resources to those with the greatest and the clearest needs doesn't happen by chance. It happens with deliberate and purposeful program design and outreach. At the same time, we worked with partners throughout the country to get state and local governments to do more to protect renters. Our partners and allies throughout the country advocated successfully for state and local governments to enact or implement over 130 new tenant protections in 2021 alone. So all of this taken together, the successful advocacy and action, this is what prevented the eviction tsunami. These historic and unprecedented resources, together with broader stimulus relief of stimulus checks, expanded unemployment insurance, expanded child tax credits, it kept millions of families stably housed during the pandemic. But now, new challenges, and in many ways old challenges, await. So those same renters that struggled to keep a roof over their heads during the pandemic and before the pandemic, they continue to struggle today, and even more so as rents are skyrocketing across the country. Our country, even before the pandemic, had a shortage of 7 million homes, affordable and available to the lowest income people, predominantly people of color. So another way of saying that same number is for every 10 of the lowest income families, there are fewer than 4 apartments that are affordable and available to them. This shortage ranges throughout the country from most severe to least severe, but there is no state with an adequate number of apartments affordable and available to its lowest income people. And much of this shortage for the lowest income people is due to decades of federal underfunding of solutions. We have a system in our country where only 1 in every 4 families that are eligible for and in need of housing assistance receives any. So 75% of households who need assistance, who are eligible for it, they add their names to years or sometimes decades-long waiting lists, hoping to win what is essentially a housing lottery system, where only the lucky 25% get the help that they need. So while the emergency rental assistance and eviction moratoriums were essential, they were only ever a temporary patch to the gaping holes in our social safety net. They do nothing to address the deep structural flaws in our country's housing system. So now, in those communities where renter protections expire or where emergency rental assistance has been depleted, eviction filings are again reaching, and in some areas surpassing pre-pandemic levels. Some communities now have eviction filing rates more than 2 times what eviction filing rates were prior to the pandemic. So these same long-standing pre-pandemic housing inequities will persist unless and until policymakers at all levels enact robust tenant protections and invest in the long-term solutions needed to make homes affordable to the lowest income people. And even before the pandemic, we saw the short and long-term health impacts of housing instability, eviction, and homelessness. We saw it in the nation's hospitals, clinics, emergency rooms, and mental health centers every day. Research consistently shows that when adults and children live in stable, affordable homes, they have better physical and mental health outcomes. They are at lower risk of hospitalization, and they're less likely to experience other economic hardships like food insecurity. For example, pre-COVID research shows that stable housing reduces overall healthcare expenditures by 12% for Medicaid recipients, increases the use of primary care services by 20%, decreases emergency room visits by 18%. A quality, affordable home is a prescription for good health. So the solutions to make homes affordable to everyone, especially to the lowest income and the most marginalized people, are long overdue and badly needed. In the short term, states and cities should use the ample state and local relief fund dollars that they have to fund immediate housing solutions as a bridge to longer term solutions. And states and cities need to further expand tenant protections. But the scale of the challenge requires a federal intervention. So we need to keep pushing the federal government to enact and fund long-term solutions. Last year at the National Low-Income Housing Coalition, we launched a major new campaign, the Housed Campaign, for universal, stable, affordable homes. The Housed Campaign works in parallel with our Opportunity Starts at Home campaign. Opportunity Starts at Home effectively mobilizes advocates from the healthcare, anti-poverty, anti-hunger, civil rights, education, and other sectors. The Housed Campaign mobilizes the housing field, impacted people, organizers, local, state, national advocates. And together we work to ensure that investments in housing the lowest income people are advanced. And over the last year, we worked to ensure that they were included in the Build Back Better Act. Ultimately, our efforts were successful, even if we haven't gotten that bill yet across the finish line. Our advocacy helped ensure that Build Back Better passed through the House and includes $150 billion in what would be transformative housing investments. These investments include $65 billion for public housing repair and preservation to make nearly 1 million affordable homes that house some of our country's lowest income people, predominantly people of color, to be decent, healthy, accessible homes. The bill includes $25 billion for rental assistance for over 300,000 new longer-term rental assistance vouchers. And the bill includes $15 billion for the National Housing Trust Fund to build or preserve 150,000 homes affordable to the lowest income people. Taken together, these investments in the Build Back Better Act are the single largest investment in quality, affordable, accessible homes for our country's lowest income people in history. As a movement, as a country, we have never been closer to investments like these that would transform our collective efforts to achieve housing justice. And it is right within our reach, but for one Democrat standing in the way. But even if we don't achieve it this year, which we still may, we are still fighting for it, we are that much closer to the finish line the next time we create a window of opportunity. Because together we have both moved the Democratic Party's stance on affordable housing to one that is much more ambitious, more willing to call for and fund solutions on the scale necessary. And we have built bipartisan support for many of our solutions. And while the housing crisis can sometimes feel deeply complex, the solutions are simple, even if they're not always easy. So there are 4 sets of solutions that taken together could end homelessness and housing poverty in our country. And the solutions are about not only major new investments, which are badly needed, but also about the essential anti-racist policies and reforms needed to ensure that these investments work for the Black, Indigenous, and other people of color who are so disproportionately harmed by today's inequitable by design housing system. So the 4 sets of solutions include: 1, making rental assistance universally available to all eligible households in need. So it should be 4 out of 4 households who needs housing assistance receives it. And President Biden committed to do this during the presidential campaign. So we will hold him to this commitment. And together with this major expansion, we will also push for national protections against things like source of income discrimination and other improvements to rental assistance to ensure that it works for BIPOC people and families. The second set of solutions is to preserve and expand the supply of homes affordable to the lowest income people through preserving and expanding our nation's public housing infrastructure, through a major expansion of the National Housing Trust Fund, and with federal requirements or incentives for local zoning reform. The third solution is permanent emergency rental assistance through a national housing stabilization fund to ensure that renters who can generally make ends meet on a day-to-day basis can absorb an unexpected financial shock that could otherwise lead to eviction and the spiraling into poverty that results. For low income and marginalized people, that shock may be from a pandemic, or it could be from a natural disaster, or it may be from the everyday disaster of a broken down car or a sick child or a missed day of work. And the fourth set of solutions is around rebalancing the power that currently tilts so heavily in favor of landlords at the expense of renters, and predominantly at the expense of Black women renters who are most likely to be evicted. So we are working to advance robust renter protections like right to counsel, just cause evictions, expunging eviction records, and more. So we will keep working to build, expand, and deepen our movement for housing justice. And as we do, we all must deepen our commitment to and our work on racial equity. There are tremendous and unacceptable racial disparities in housing, and these disparities didn't happen by chance. We had decades of racist housing policies that purposefully put homeownership out of reach for millions of Black Americans, creating the yawning generational wealth gap that persists today. Those Black families that were able to become homeowners despite all odds were then disproportionately targeted for predatory loans and lost tremendous amounts of wealth during the Great Recession. These are just a couple of examples of the structural racism in multiple systems that create the clear racial disparities in housing and homelessness that we see today. So for example, Black families make up about 13% of the general population. They are 40% of people experiencing homelessness, and they are 50% of homeless families with kids. And rates of Native American homelessness are also disproportionately high, 3 to 8 times higher than their proportion of the general population. These kind of racial disparities don't happen by accident. They are the results of deliberate policy choices. Evictions, too, aren't just about poverty, they're about race. In some cities, Black women are evicted at 3 to 5 times the rate for white women in the same city. The bottom line is that people of color are dramatically more likely than white people to experience evictions and homelessness in the United States. It is the result of centuries of structural racism and discrimination that persists today. And just as these disparities occurred through deliberate racist policies, it's only through deliberate anti-racist policies and reforms that we will correct for the harm done and work towards racial equity. So housing justice and racial justice are inextricably linked. So we have so much more work to do, and the challenges ahead are daunting. Racial injustices persist. Emergency rental assistance is running out while significant needs remain. Homelessness is increasing in many communities, and with it, a backlash against obvious solutions is also increasing. Rents are skyrocketing. Public housing is deteriorating. Long-term solutions, so obvious, so easily funded by a country as wealthy as ours, remains just out of reach. Build Back Better is stalled, and the window to get these historic and critically needed housing investments across the finish line is closing. So for me, these challenges only strengthen my resolve to keep fighting. I have said for years in speech after speech and conference after conference that we have only ever lacked the political will to end homelessness and housing poverty in our country. Certainly we have the resources, we have the data, we have the solutions. We've only ever lacked the political will. And the pandemic proved it. When our movement for housing justice saw the danger the pandemic posed, we aligned with a singular focus to protect people who are homeless and struggling renters, to save lives and to keep people stably housed. And we did. And when government at all levels recognized the emergency and the need, it acted and funded solutions on a scale unlike any in our lifetimes. Together in just 2 years, we achieved what once would have been considered unthinkable, impossible. So now, on those days when our goals feel impossible, when the difficulties of the work and the challenges seem insurmountable, on the days when we feel like we can't or we won't, we have to remember that we did. We achieved the unimaginable. We did the impossible. And together we can and we will do it again. We will keep struggling and fighting until we end homelessness and housing poverty, until we achieve housing justice in our country once and for all. So thank you all again so much for the opportunity to be with us. Thank you for the work that you are doing in your communities. Thank you for leading and for believing. And thanks again for the opportunity to be here today. I look forward to any questions and conversation.
Thank you, Diane. So we have a few questions in the Q&A, so I'll start there and then we can go back to the Zoom. But thank you so much for that. So the first question, are you familiar with efforts of Denver and others to provide safe spaces for unhoused individuals? If so, I'm curious as to what your thoughts are in such spaces. Our Albuquerque City Council is currently deep in considering these as an option to support unhoused individuals.
So I'm not familiar enough with the specifics in Denver to be able to talk to that specific program, but I can speak more broadly to say that certainly homelessness is increasing for the past 4 years now. Homelessness has increased, and the latest data that we have is still from before the pandemic, and it's certainly increased further during the pandemic. We, along with increased homelessness generally, we've had an increase in unsheltered homelessness. So for the first time ever in recent years in the state of California, of all the people experiencing homelessness, there are more people without even emergency shelter than there are with. So the number of people who are unhoused and unsheltered is also increasing. And that's creating in many communities a public health challenge and a real tension between the kind of solutions that we know are needed, like permanent supportive housing. You know, the one thing that ends homelessness is affordable, accessible homes. That is what is needed for all. That is what is in such short supply in so many communities where homelessness is increasing. And at the same time, local encampments are creating this tension for local policymakers to figure out how to manage the pushback from the community who is housed and how to create safe solutions for the community that is unhoused. So it's a real challenge. I think the most important thing is that communities approach unsheltered homelessness as the public health challenge and emergency that it is, and lead with solutions that center the dignity of people experiencing homelessness and gets them both either the emergency adequate shelter and ideally the long-term housing that's most needed, as well as the supportive services that are needed. So there's some communities that are looking at and putting in place encampments rather than doing sweeps of homeless encampments, which is the wrong approach for individuals and our collective health, especially during a pandemic. But it also just makes an incredibly challenging experience for a person experiencing homelessness that much more challenging. So sweeps on their own are not acceptable. And some communities are continuing to move down that road, which is harmful. Instead, some communities are adopting this public health approach to encampments and finding ways to get services to people who need it, create more immediate emergency shelter options that are safe for people, that people feel like they can go to while they work towards the long-term solutions, which is ultimately affordable, accessible housing with wraparound services for some people.
Thank you, Diane. The next question, I work with the elderly and an already disadvantaged population. How can I gather resources for this said population? She's hit very many roadblocks for services for her clients.
Well, there's two challenges there, one on the housing side and the other that the questioner mentions on the services side. When it comes to housing, when we look at who are extremely low income renters, which is the population that my organization focuses on, half of them are seniors, or they're people with disabilities, or both. And they are on extremely limited fixed incomes that makes it difficult for them to afford any kind of housing, much more difficult for them than most other segments of the population, because we are talking about sometimes a single person who is managing with about $12,000 to $15,000 annually in income, and housing prices being as high as they are, it's impossible. So again, this points back to the work that we do and the tremendous need for more affordable housing that is focused on and affordable to extremely low income households, for which we have a tremendous shortage throughout the country. So we have a lot of work to do there to make homes affordable and accessible for seniors and for people with disabilities. The other challenge too is on the services side, and this is the same, in many ways, it's the same conversation both for people who are experiencing homelessness or for seniors or people with disabilities or others who need services in order to help them maintain their homes once they're in it. And that's a place too where it's very challenging for local communities to get the resources that are needed to fund those services. And sometimes we've seen cases where they are able to get the affordable housing from some programs at the federal level, but the services funding is what's lacking. And those services are often essential to keep people stably housed. So I don't have any quick or easy solutions to offer there, except to say that this is another one of the systemic challenges that we face in our country that requires systemic solutions and more resources.
Thank you. The next one's more of a comment, but maybe you can speak to it. Rural communities struggle with enough housing inventories. Even for people with means, housing is almost non-existent in our community. Those without means are basically shut out of being able to find adequate affordable housing. This also impacts workforce and being able to bring in new business. We need federal and state level funding specifically for rural communities for new housing projects.
Yeah, absolutely agree. Again, when we look at the shortage of homes for extremely low income people, it's pervasive and it exists. That shortage is in rural, suburban, and urban communities alike. And the only difference is the severity of the shortage. It ranges from least severe to most severe, but there is no state, and there are very few communities that have an adequate number of homes affordable for the lowest income people. So yes, we need solutions specific to rural communities that often have a specific set of needs. For example, a lot of times in rural communities, one thing that we find is that the housing stock, and especially the affordable housing stock, can be very old and in some cases in severe disrepair. And what's most needed there, in addition to creating more homes for that population, is resources to preserve the affordable housing that exists today and bring it up to code and make it safe and decent for the people who live there. But the challenges exist throughout the country. And one of the programs that we helped to create at the federal level and now push to get fully funded is called the National Housing Trust Fund. That's a program, if it were funded at the scale needed, that helps states and cities build and preserve apartments affordable for extremely low income people. And it's been used very successful in rural communities, just as it has in suburban and urban communities. The problem is that its current funding level, this year's funding level, is the highest it's been since its creation in 2008. This year's funding level is just under $1 billion for the entire country. So it's a drop. It's such an important and successful program, but the funding level is just a drop in the bucket compared to the need. So we're pushing for $45 billion annually for that program in order to really be able to preserve all of the housing that's needed and be able to begin to build the number that are needed and make sure that they are affordable to the lowest income people.
Thank you. Next question, what is the best way to offer services to those who are experiencing homelessness when they do not have vital documentation, birth certificate, ID, social security, etc.?
Well, that really depends on the local community and the outreach and the services that are available. It varies tremendously from city to city and state to state. I'd say, there's a lesson that we can take from the emergency rental assistance programs that I talked about and that many of you may be working with in your community. One of the things that we found very clearly is that the more documentation that's required for that program and often for other programs, the harder it is for the most marginalized people, the people with the greatest needs, to access. So the more we can simplify programs, simplify applications, simplify documentation requirements, use self-attestation for eligibility wherever possible, the more we're going to be able to meet the needs of the people with the greatest needs. That was very clearly seen with emergency rental assistance programs. There were a number of programs that were just simply not accessible to the people who needed the most, requiring documentation that marginalized or impacted people don't have access to, is a problem and that needs to be removed, and oftentimes can be easily removed if the program administrators are willing to do that.
Thank you. So the next question is a little bit similar regarding barriers. How is communication with homeless individuals for follow through kept open? Are office visits a primary contact source, or is regular outreach or another alternative form of contact used in your experience?
Again, there's a great variation from city to city and community to community. I'd say the more outreach, the better. In many communities, meeting people where they are in ways that are non-threatening and accessible and helpful to them is going to get the best take up of the services that you're offering. So street outreach, going to encampments, for example, and ideally with not only the emergency immediate needs being able to be met, but some plan for medium, if not long-term needs, is going to get the best result from people. Keeping in mind who is doing the outreach is also really important. So if you have the more people with lived expertise can lead on outreach and actually in all areas of the work, the more effective it is. So the more likely they are to be trusted by the people who we are doing outreach to, and the more likely they are to be knowledgeable about what makes an effective outreach program.
Thank you. And I think this is more just, you know, for the audience, but what is the most impactful thing that most people are capable of doing right now to help end homelessness?
So that, you know, I am a deep believer in the essential, in how essential systemic change is. All of the challenges that you work on day in and day out at the local level are caused by systemic issues, and it's systemic solutions that are most needed. So your work at the local level is essential on a day-to-day basis to help get people to safety to the extent that you can with the resources that you have. But what's most needed is for federal, state, and local governments to better prioritize the needs of people who are homeless and extremely low-income renters. In the vast majority of communities, especially now coming out of the pandemic, with all of the resources that the federal government sent to states and localities, the vast majority of communities have more money than they've had in years. And it's a question of prioritization. What are they going to choose to spend that money on? Some communities are spending it on policing and prisons. Other communities are spending it on emergency rental assistance, homeless shelters, services. So you have a really important role to play in talking with your elected officials at the local, state, and federal level to urge them to do more, to better prioritize the ample resources that we have as a country on the needs of the lowest income and the most marginalized people.
Thank you, Diane. Just a few more questions here. What work do you know of specifically is being done to assist youth aging out of foster care or juvenile detention?
Yeah, that's so important. There's a small, really effective program administered by the Department of Housing and Urban Development called the Family Unification Program, or FUP vouchers. So these are time-limited rental assistance vouchers specifically for youth aging out of foster care, because they are so highly vulnerable to experiencing homelessness or extreme housing poverty when they age out of foster care and no longer have a safety net of any kind to help them stay housed. So this program has been around for some time. It's very effective. It's another example of a program that works that we're not funding to the scale necessary. So if that's something that you work on locally, one, you should talk with your local housing authority to see if they have any family unification program vouchers or FUP vouchers available, and what needs to be done in order for the people that you are working with to access them, but also, again, to weigh in with federal policymakers about the importance of this program, the importance of resources to help youth aging out of foster care avoid homelessness, and for them to prioritize funding those programs at a bigger scale.
Thank you. I'm curious if you know how the hotel takeovers have been working out. I've noticed many in Albuquerque have been converted over. Instead of some of my caseload have been able to find housing that way.
That's great to hear. I feel like we don't hear nearly enough of that, because that was this tremendous opportunity that presented itself during the pandemic very early on, with FEMA for the first time ever acknowledging that people experiencing homelessness have immediate needs during a disaster. In this case, the disaster was the pandemic, but we have been pushing FEMA to acknowledge that after many natural disasters like hurricanes. So it was a huge shift for FEMA to say people who are homeless are at heightened risk during the pandemic and need safety. So what FEMA did, the federal government said they would pay 100% of the costs for certain eligible people who are experiencing homelessness to move to safety in hotel rooms. And sometimes there were services provided there as well. Even then, early on, when the federal government was saying they would pay 100% of the costs, there were too few communities taking them up on that. And in many cases, it was because those communities were worried about what was going to happen when that funding ended, and they no longer had funding to pay for those hotel rooms, and they had no affordable housing options to move people experiencing homelessness to. So too many communities missed that opportunity altogether. Some stepped up and really took advantage of that, took a leap of faith in many ways by using those resources that were available right now, not knowing what they were going to do when those resources ran out. And in the meantime, we worked with key members of Congress to push for some resources to go to local communities to allow them to purchase some of those hotels and motels and turn them into permanent supportive housing. So there too, so Congress provided about $5 billion that went to states and localities through the HOME program, specifically for this purpose. And we have seen some communities, I'd say maybe about 8 states that I know of that are using these resources now to buy hotels, motels, and also other sometimes office space and to turn that into affordable housing. It's a win-win situation because it's cheaper to acquire and preserve or reconstruct a building than it is to build one. It's cheaper and it's faster. And these are providing a type of housing that's missing in many communities' housing stock ever since we got rid of single room occupancies, over many, many decades ago. So I'm really glad to hear that that's working in your community and that some places are doing that. I think I would love to hear more about that. I would love to find ways to help you amplify the work that's being done, because those few communities that are doing this are really serving as a model of what more communities can and should be doing.
Thank you. So I think that concludes our questions in the platform. Is there anybody live that would like to unmute themselves and ask Diane a question directly? I'll just double check the platform here. I think we've answered most of them. I think we've spoken to this, but is there a centralized place we can access to refer those experiencing homelessness to the appropriate resource?
I can't speak to that. There may be in your state or in your community, but I don't know for sure.
Okay. We have one here. In Santa Fe, New Mexico, we are consistently losing low-income housing tax credit projects. Other than policy advocacy, what can we do to assist our communities from having to move away? That's what most are doing.
Well, there's the local process of how low-income housing tax credits get allocated that the State Housing Finance Agency administers and oversees. And there's this very wonky but very important process that they go through in putting together what they call the Qualified Allocation Plan, the QAP. that determines the priorities for the low-income housing tax credits in that community and what types of housing and which communities it will be built. So getting involved in that local QAP process is important and can be very consequential. So I'd encourage you to do that. And beyond that, I'm afraid it does come back to advocacy, because again, we're looking at another example of a program that can be highly effective if fully funded, but receives far fewer resources than what's needed. So get involved at the local level, make sure that those scarce and precious tax credits that are coming to your community are being prioritized in the way you think is most needed, and then use those examples of the need and the success to make the case for why we need more resources.
Thank you. So I'll give the audience one more opportunity to ask any questions live. I'll give them just a few seconds. Okay, Diane, well, thank you so much for sharing your time and expertise with us. We really appreciate it. I hope that the audience found this helpful. This presentation will be it was recorded and will be available to watch back if any of you missed the beginning. Just a few reminders. Please remember to do your evaluation by clicking the survey rate button and include your email address for the CEUs. You could also email me directly with any questions. Thanks everybody for joining us today. Please remember to check your dashboard or agenda for more information on our next session, our final session for today, which will feature Martha Escudero, who will speak to the root causes of the housing crisis. Thanks everybody. Please have a great lunch, and we will see everybody back at 1 o'clock. Thank you, Diane.